So AJ, what's your favorite part about being an oral surgeon?
I mean, I've always liked the blend of medicine and dentistry. I'm also a big person on instant gratification. So the kind of take two of these and call me in 2-week philosophy didn't have much of an appeal to me. So I like being able to see a problem in front of me, coming up with a solution, and then solving the problem, as quickly and efficiently as possible.
Yeah, I think that's a great summary of what we do.
Yeah.
And what can, if new patients come to our practice, what kinds of things can they expect?
Well, I think first and foremost, an honest answer. I think coming in, we like to bring everyone in for a consult first, so we can sit down. I think it's very important to both of us to make the patient feel heard and listened to, so that we understand what their issue is, and we can come up with a plan to solve it between everyone, between you and I, the patient and our team here, and then treat the patient as efficiently as possible. What do you think?
Yeah, I certainly agree. I think kind of some bouncing off of that. Not only can they expect all the things that you said, but also we certainly value having, if there's a better way to do things, we're certainly all about that, whether that's through technology. Our staffing, we have mostly registered nurses here to help us in the clinical setting, which is certainly different than most practices. And further, we've taken steps to become the only AAAHC certified ambulatory oral surgery practice in the state of Michigan, which I think something we certainly hang our hat on that, and again, sets us apart, and just as a manifestation of our commitment to doing what's best for the patient and trying to always further ourselves even when it's not required.
Yeah, I think that's a huge thing to hit home, is that rule number one here is safety. Like you said, we've taken a lot of extra steps and unnecessary steps. I guess in our mind, they are necessary steps to ensure that we are doing things as safe as possible. And sometimes that even means that maybe we can't do exactly what the patient wants in the name of safety. But that's a decision that we make, together with the patient, always keeping the patient's best interest in mind.
Absolutely, couldn't agree more.
Can you explain what patients would expect on, their first visit to our office?
Certainly. We absolutely understand here that a visit to the oral surgeon is not something anybody is really thrilled to participate in.
I always joke I should have been an orthodontist.
Yeah,
everyone likes going to see those guys.
Exactly. They got candy and all kinds of fun stuff. But no, we get that, and so we're certainly respectful of that. We'll try and absolutely value your time, get you in an efficient manner. Obviously, we'll talk through the treatment that was recommended by their dentist, why they're here, any other concerns that may have come up. After myself or you meet with the patient, they'll be guided to a treatment planning coordinator who will go through the treatment plan with them, kind of what we're recommending, and beyond just re-explaining the treatment that we have gone through with them, they also will go through all their benefits with them, talk about the co-pays, insurance. Obviously, we're a network with a lot of insurances, and that complicates things for the patient in terms of how to get the reimbursement, but we will show them exactly how that's going to happen, what to expect, as well as go through the expectations for the day of surgery, get some handouts on as far as post-op instructions ahead of time, just so again, we're kind of getting through all those maybe difficult items surrounding surgery and giving them the clearest picture as to where we're going and how we're going to get them through this, safely and as comfortable as we can, I would say.
Yeah, I think, just to summarize, all about open lines of communication.
Certainly.
That be between you and I and the patient, our treatment coordinators and the patient, and you and I communicating with our referring dentist as well.
Absolutely.
To make sure that not only are we meeting the patient's needs, but also meeting the requests of their dentist as well.
Sure, yeah, it's definitely a team sport. The dentist drives a lot of the treatment, and we love working with our local dental community to serve this patient population we have here in Grand Rapids.